All right, good morning. Phil Pugh here for our monthly coalition meeting. Thanks for everybody for joining. Looks like we have about 23 folks online this morning. We'll go ahead and get started. Just a quick administrative reminder, if you are not speaking, please mute your microphone so we don't have any uninterrupted speakers, or we have folks in the background that don't know that they're talking. This meeting is recorded. If you do not wish to be recorded, you could remain silent and just stay on. But if you don't like to be recorded and you may have something to say, just give me a call or something like that. But we'll record this, post it to our YouTube, and you can watch it later. All right. Let's go ahead and get started. Quickly reminder for those folks who have IMATS accounts, make sure your SAM's information is correct so you still have access to IMATS. Let's go through a quick roll call. We'll start with our hospitals. Anderson Hospital.
Phil, I'm here. I'm also representing Community Memorial Staunton.
Yes, sir. Thanks, Eric. Alton Memorial. I think Aaron just jumped on for Alton. Gotcha. Who do we have? Boyd. I don't see Nancy on. Carlinville Area Hospital. How about Fayette? On vacation. All right. Gateway. No, I saw Rick on here earlier. If you're talking, Rick, you are muted. Oh, he's pressed the hold button, so maybe he had to take another call. But I do see him here. All right. Where are we at? Our HSHS partners. Anyone from Holy Family?
Right here.
Who's that?
Cindy Crouch.
Thank you.
What?
And who was the second person?
Okay.
All right. Moving on to St. Elizabeth's. I don't see Brad on. Anyone from St. E's? Okay. How about Breeze? And Highland. What about Jersey Community?
Kelly's here.
This is Nick.
Gotcha, Kelly. Thank you. From Memorial Hospital Belleville, you got myself, Mike. Lee is actually off on PTO right now, unless he decided to sneak in while I wasn't looking. And Eric Perham for representing Shiloh as well. How about Memorial Hospital Chester?
Hi, Georgia's here.
Gotcha, Georgia. OSF St. Anthony's.
Gary's here.
Gotcha, Gary. Redbud Regional.
Phil.
Oh, okay, gotcha. Thank you very much. Redbud. No, Tara's on.
Tara, Redbud's here.
Gotcha, Tara. Thank you. Sparta. Got Dan
Dan's
on.
here, Phil.
Thank you, Dan. And again, looks like Gateway still has us on hold. I don't know if Danielle was able to join, but I do see Eric. All right, our health departments, we'll go through these really quickly. Bond County.
Wendy White here.
Gotcha, Wendy. Thank you. Calhoun County.
Megan Eilerman here.
Thank you, Megan. Clinton County. Eastside Health.
Eastside Health District present.
I gotcha, Charmaine. Thank you. Fayette.
I'm here, Kendra.
Gotcha, Kendra. Greene County. Jersey County. Macoupin.
Eric here, Phil.
Gotcha. Thank you very much. Madison County.
Aaron here for Madison.
Thank you, Aaron. Monroe.
Vicki here.
Gotcha, Vicki. Randolph County. And St. Clair.
Good morning. Kara's here from St. Clair.
Thank you, Kara. Our other community partners in IDPH, starting with our RMSC, Greg.
Greg's here.
Gotcha. Our ERC is Beth. Was Beth able to make it? No. Unless she called in, I don't see her signed in. Any of our BJC partners? Any EMAs on?
Morning, Phil. It's Sam.
Gotcha, Sam. Thank you very much. Anyone from MedStar Ambulance?
Yes, Phil. John Nowak's here.
Busiest man I know, John. I think you need
Well,
another
actually,
vacation.
I'm on the road. I'm on the road, but I'm here.
I know it. All right. Abbott. No, Leslie today. Okay. SLU. Let's see, SLU. Any of our Scott Air Force Base partners on today? I don't see Tim today. And Stars. Who do we got from Stars on? No one from Stars. Okay, for those who were who may have not got an opportunity to sound off, you can sound off now or just put your information in the chat and we'll make sure we capture that. I see Margie for Breeze and Dawn St. E's. Okay, gotcha. Anyone else? Gotcha. Kim Lampert. Who else you got? Okay, yeah, lots of folks.
Green County.
Gotcha, Molly. Thank you. I got you, Rachel, AMH. Ron, Green County. Thank you. Gotcha. We'll go ahead and get started. I think we got the majority of folks here. Our agenda today going to be the standard agenda, and we will cover the latest with the grant and the FY. It says 22. That should say 23. My apologies. Budget and a few other things. So we'll start off with IDPH. Greg.
Good morning, everyone. I just have a couple of things that I wanted to bring up. The first thing I brought up before, EM Resource. I'm waiting on the June report to come out, but we have a number of our hospitals who are still having very low response to the monthly statistics on updating areas. I think of those of you who read the ChemPAC After Action will note that there were more than a majority of hospitals, I believe, that did not respond to that exercise query. We're really having some issues, or at least I'm having from a state perspective, issues with that stuff. I know a lot of times the emergency preparedness person is not the person who's doing that, but it definitely needs to be part of your job at the hospital. That if EM Resource isn't being updated EMS wise, that's regulatory, it's in state statute. And then for exercises as a disaster person, you guys really need to follow up as to why or what the issue is that acknowledgement and updates aren't happening when we have exercise or even real events such as the tornado at Amazon. It's impossible for us at the state level to know exactly who is tasked with that at each one of your facilities, and it changes regularly. So it is really going to be incumbent on you guys to make sure as a disaster person that there's follow up on that, because our next step is going to have to be to reach out to administration at your facilities to say, you know, we're obviously not getting through, you know, what can you do to help us? And I'm not trying to do that like with a stick. It's just, I have no idea who to reach out to anymore. I mean, there are contact names in EM Resource, but then when I talk to the facility, they'll say, oh no, not that person. You need to contact this person. It's just impossible for us to keep track of who we need to follow up with. So we really need to task you guys with that aspect. The other thing with the Kempak after action, I don't know if Phil is going to touch on this, but something I didn't really see in there, and it's probably because of there weren't a lot of hospitals that participated, but every hospital should have their own facility-specific Kempak outline for your staff to be followed and that to be taught to, along with what the regional plan is. Your facility plan doesn't need to be huge. It just really needs to be there to specifically tell people what they actually need to do. And that needs to be taught to the ED staff and physicians. The third thing is to the system coordinators. I see some of them are on. We sent out, the state sent out a Mercy Radio Survey Monkey on use of Mercy in their facilities. About 1/3 of the hospitals have responded. So please send that back out to your participating and associate hospitals and ask them if they have not completed it to please complete it. Because we have a radio guy now and he's got to get a handle on where everybody in the state is at as it comes to Mercy and STARCOM. And Phil, that's all I have unless anybody has any questions.
Thank you, Greg. So yeah, I'd like to follow up on just a few of those things. What Greg is talking about regarding EM resource, it is a big key. That is how, how we have it written from the regional level. I'm not even talking about the state. We know what the state has asked us to do and require us to do. The day-to-day updates aren't as bad, but the no-notice drills that we conduct have gotten worse and worse over time with the level of response. And if you'll take a look at the after action report that I sent out for the Kempak exercise, again, very low turnout or response rate in my estimation. I think I just don't have it right in front of me. I should have just pulled it up. But I think what we have in there is that from a region perspective, is you need to update that within 15 minutes of the request. And oftentimes it's either goes unacknowledged or is updated much later than it needs to be. So your EDs are the lynch point, and if it needs to be your house supervisors, whoever you deem that, you need to have folks with access. So we can help, and in part of what we have in the after action plan is to reinforce to hospitals this point that Greg is talking about. And what we're going to do is what we've done in the past as an RHCC / the coalition staff, whatever you want to call us. But myself, Lee, Eric, we're going to put on, a minor workshop, maybe about an hour, on how to update EM resource and what event notification preferences you need to ensure that your organization is triggering, and making sure that, you have to make sure the settings are right. It doesn't come pre-box to give you what I would say, the proper notifications for MCI or high important alerts or what have you. Well, we'll go through that and show it, but it will take you guys to follow through and make sure that those settings are done for all of your staff. If you have a charge nurse who has an account in the ED and I send out an MCI alert and he doesn't have MCI alerts as the notification preferences, she could have EM resource open and still may not get alerted if she doesn't or he doesn't have it in there correctly. So, and to Greg's point regarding having a plan or policy within your organization, yes, that is a must. We ask in the Kempak plan, as with all annexes and plans that we have for the region, we in the preparedness role for all providers, we say make sure that you're familiar with the region's plan or the state's plan, and develop a local policy or procedure or plan for your organization. So when that annex is initiated, you guys have something that you're following to make sure that you're meeting all those check marks. So please, EM resource, yes. and making sure you have a local plan, vitally important. So I hope folks did get a chance. I know you probably haven't got a chance to digest the after actions report just yet. Try to flush it out with the biggest points in there. But we did make that available yesterday or day before yesterday. So please take advantage of it. Look over it and see where you fall. And I do believe we included also the response rate for the EM resource. So yeah, we'll just say EM resource participation. Yeah, only 3 out of the coalition 19 hospitals, that's 16%, were able to update it within 15 minutes, and that's per the EOP section 10.5.1. Okay, so yeah, it started at 9:15 or started at 9 o'clock that day, and at 9:15, only 3 folks had updated within the appropriate time frame or whatever time frame we started. Maybe we started at 9. I'm sorry, we started at 9:15, and only 3 folks. That was Anderson, Chester Memorial, and Staunton. So great. Not even our folks here at Belleville. You know, I treat them the exact same way. I didn't get a response from Shiloh, so they heard from me, and they have to have an after act. They have to have a plan to respond to that as well. We did have 1, 2, 3, 4, 5, 6, 7 organizations that did still respond, but responded late. And we had a total of 9 hospitals that did not respond in total for the duration of the event. So, all right. So thanks for bringing that up, Greg, and helping me get some of that out information. Any questions for Greg or I? Okay. Health departments. Again, Beth isn't on, so I'll just pause just for the health departments that are on if they wanted to make any general announcements for the coalition. Floor is yours for the time being. Anyone? Okay, hearing none, we'll go ahead and move on. Any updates from STARS? I don't know if Sam jumped on or anyone else from STARS jumped on in the meantime. Okay, hearing none, we'll move on. Remert, Mike just had a response that they were going out to for a turned over trailer, so I don't know if he's back on, but we did have
I'm here.
Okay, any updates?
We're just prepping for supporting the ISP youth camp next week. We will have providers out the entire week with them, helping them with medical coverage and dealing with medications and stuff like that. Just supporting the ISP youth camp throughout the week.
Copy that. And can you talk just talk a little bit about what the youth camp is like and what your kind of role is when you guys do this each year. I think this is our second year or third year. I can't.
This is our second year supporting them since we had 2 years that were canceled because of COVID.
Because of COVID.
But so we go up, we work with them through pre-planning, and we work with them to ensure that that the proper paperwork is put together. Then we help them with the help of some pharmacy volunteers that volunteer their time with us. We check in all the medications, make sure the instructions for all the medications are there, make sure that we have all the prescription bottles that show what it is, what the dosing is. We take care of all that with the help of one of our pharmacists and some pharmacy students. They all come in to help us work, go through that, make sure everything's there, account for everything, and then we keep it secured so that it's available, and then help with documenting med passes 3 times a day and covering any medical issues that come up while we're at the camp. The last time, most of them were heat related. We did have one that we wound up transporting out, but we handle all that. The parents all have a direct line to us through a coalition sponsored phone that we use for our duty officer. They can call that and get a hold of us at any time day or night, and we have someone there 24 hours a day. This year we're helping, we're doing a little different. So we're going to also be helping them. All kids have to have, when they get checked in, have to have a COVID test done on them. So we are working with the state police and their EMS system as a collaborative to do testing so that the state police can see all the testing. So
Thanks, Mike. And always another plug for REMERT. Everyone doesn't have to be a provider. Everybody doesn't have to be a medic. Everyone doesn't have to be a physician, nurse, EMT. If you've got some skills and some time, the best ability is availability, and REMERT could use you. So thanks, Mike. Moving on, decon training. I'll just make a quick note. Next decon class is going to be on the 11th of August, and that's here at Memorial Hospital Belleville. I haven't checked to see how many folks have signed up. Last time I looked, it was like 3 or 4. So we got plenty of room there if you want to get into that. I'm pushing my team here at Memorial to get into it, but it is available for the region as well. So if you got some folks that need to get training, that's an opportunity for you. Eric, I don't know if you're on.
Hey, I'm
Any pediatric updates?
not really that many. They're just still revising the pediatric portion of ESF8 and going through some of the disaster planning for pediatrics. The one thing that I would highlight, in addition to advocating for CDAP, BDAP, is also making sure that if you are a pediatric facility, that you are doing your exercises and making sure they're documented so that when inspections do come up, because I don't know what cycle you're on, but ours is every 2 years. So making sure that everybody's got their stuff together so that when these folks do show up and you have your exercises, that you don't have to worry about any of your accreditation issues. That's all I got, Phil.
Thanks, Eric. Like I'm getting a call. Let me divert that. I apologize. Let's move on to, again, yep, another plug for EDAP. Thanks, Eric. General grant status. Deadline for submissions for the FY23 grant is today. So we will be requesting just coalition approval to move forward with the proposed budget. Things are really, really cramped as far as the duration. Normally we have a lot more time. So for those of you who are new to this, normally we will have anywhere from April to June. In June, we do this portion because we'll have the budget kind of finalized, but I basically had to finalize it this last week or a week and a half over the holidays too. So we're going to cover all of that. So this is kind of a look at how the BP3 budget, the FY21 to 22, the FY22 budget looked last year. There's some new categories and a few things kind of got flushed out, moved around over to the FY23 budget. So what's used in salaries, travel, equipment, supplies, contractual contracts, occupancy, rent, all that type of stuff, telecommunications, and training and education. We'll kind of cover those a little more in depth here. This is what that breakdown of each one of those categories looks like. There is a concerted effort. Greg, you may have to help me. I can't not remember the percentage that IDPH and maybe even ASPR is looking to make sure that we're not putting into equipment of your budget. Do you recall what that was off the top of your head?
I don't off the top of my head, Phil. I'm sorry. I can certainly find out.
It is a substantial amount. I want to say that less than 50% of your total budget can be in equipment. In previous years, we've had fairly substantials. I would say the most we've had is somewhere around 40% of the total budget. But this year, because we have been able to kind of cut back, as you can see, equipment only constitutes around 8% of the overall budget. We did a lot of procurement of ventilators and other equipment over this past year and a half, 2 years. So that's really, really helped. We have a goal of having 30 portable ventilators, the X-Vents that you guys have seen. I know some of you guys have been familiar with and trying to get more of those out to our resource hospitals. So I think by the end of this, we'll have somewhere on the order of 24, 25, might correct me if I'm wrong, but somewhere around there. And then hopefully these next outgoing years we'll get all the way up to 30 and we'll have a good cache of ventilators that we can use. So this is kind of what it looks like as far as the pie, how the pie is divided up. And let's talk about a little bit of those specifics. We're not going directly into full salaries just yet, but I will say that Scott Klosterman, my salary, Lee French's, and Eric Perham's salary are partially paid for by the grant. So between that and what they call and the benefits or what have you that's there, we're right around 99,000. Let me just go back and take a quick look. Sorry, yeah, around 99,000. That's actually lower than previous years. We've been as high as 110,000, but we're right at 99,000 of the 522,000 we received this year. So back over to travel, we've got some baked in travel costs that we have in there for attending the IAM conference, the National Healthcare Coalition Preparedness Conference, the IDPH Summit, and any local mileage that we do going to visit other hospitals, delivering of equipment in and around the region, doing inventories, et cetera. So we do charge that to the grant. So that totals up to about 15,000. This does not include any travel that Eric, I'll pick on you now because traditionally in past years in project requests, Eric, he normally attends Joint Commission Summit or what have you and provides some of the details that he received back from that or whatever good nuggets that he can pass on to other hospitals about preparedness and how to better prepare your hospital. What are best practices and stuff like that. He'd put that in there, but that will go into his individual contractual agreement that he has with us. So that money would be in contractual, not travel. This is specifically the staff, my team here. So we'll move on from there over to equipment. We're looking at getting a warehouse forklift and some radiation detectors for each one of the hospitals. Some of you are already familiar with the Friskers, the model 26-1s, the Ludlums that we use during decon training. Those are for active checking of patients and staff when you have a radiological event. We talked about a lot of this during the radiological tabletop exercise, which was, I thought, a resounding success and a good look into of what we got coming in the radiological support annex for the region. But these radiation detectors here, we're looking at are more passive in nature, can be used actively as well, but we're trying to increase the hospital's ability to passively detect radiation for folks that may enter into the hospital from MCI event. And when they pass by this detector, and it's a handheld detector that can be sat on a desk, it's fairly sensitive, that you could have some form of inkling that you've been exposed or that this patient has potentially been exposed to radiation. So about 29,000 for those. They're about, I can't remember if they were like $1,300 or $1,400 a piece, but super easy to use and well worth the price of admission. On the supplies front, Remert, rounding out some of Remert's just general consumables, around $4,000. We are procuring some evacuation boxes from DQE to support hospitals who would like these assets. We think that they're a great kind of one-stop shop for our critical access hospitals. Work really good. They're about $585 a piece. I was trying to get enough for all the hospitals and a little bit more, but it looks like we had to cut that amount in half. I think that's a total for 13 that we can get out to some of the hospitals. And maybe if we have some money left over at the end of the year, we can finish that off. But that's what that is. We have some warehouse shelving that's going to go into a warehouse facility so we can house our equipment and supplies for the region. Contractual services. These are all the things that we pay for every year that you may or may not know about. The Radiac calibration, the radiation detectors that we have currently here at Memorial Hospital, and some of the ones that we're still holding on for the region that folks have not picked up. And again, we talked about that during the tabletop exercise. If you don't have one of the Ludlum 26-1s, Frisker GM pancake probes for detecting radiation when doing decon, you need to give us a call and make sure you get that sent out to you. But we keep those calibrated annually. DTN, we use that as it's a weather service. It's when we have bad weather across the region. That's what we're using to look and forecast. And this is something that we use a lot with REMERT as well, because when we have these big events that we're planning on, we utilize that service very heavily. It also gives us access, for those that don't know, gives us access to custom weather reports for highly specific weather reports for specific areas. And we get kind of like our own weather person that develops those for us. So as a service to you guys, if you guys are running some major events and you want some of that specific weather information, all you got to do is shoot us an email and we can get you like a customized weather report for your specific area. Also D4H, incident management. You guys are very familiar with D4H, our common operating picture. We use that. We do include, you can see in regional trailer and generator maintenance, about $7,500 a year. We just put that in. We have, tires that maybe blow out, or we get a leak in a trailer, something that needs to get fixed on a trailer or generator. We just have that money. And a lot of times we may use about half of that. And then we reallocate it later in the year to something else. A lot of this has actually been going to Eric Perham's, not the bane of existence, his joy of his existence in retrofitting our current decon trailer and getting that back up to snuff, because we had the hot tankless water heater explode on us. So now we're getting that fixed. You'll see in their regional website maintenance that pays for Member Planet and our website that we use, our external facing website. The REMERT paging service, that's I think that's Active 911 or something similar to that Mike and the team use for REMERT. That Microsoft Office 365, whether you know it or not, most of you do. Some of the newer folks may not know, but we do try to keep up with this Office 365 account as a additional source for the hospitals to communicate using. So if you don't have an account and you are a hospital, please let me know. I know we got a few of our EMS agencies as well that can utilize or have access to utilize. I'm pretty sure John Nowak has an account. But that's for you guys, and it also provides you some additional storage and a whole bunch of other things. And it allows us to use Microsoft Teams like we're using right now. We do that. QNFT equipment calibration. We have 2 port accounts that are capable. Port account are the quantitative fit testing pieces of equipment that you guys, are probably familiar with in your hospitals when you guys have to put on a mask and you got to get fit tested. We have 2 of those. We utilize those for REMERT, and if we want to be able to support a hospital that has to get a lot of fit testing done, so to increase responders' safety and health. So we have those here. Those have to get calibrated. Something new that we're adding this year is Shield Us. That's what it looks like, but it basically is a program that tracks all like natural disasters throughout the United States by location. It also has the social vulnerability index data baked into it. And what we're doing this year is we're going to get an account. I've used this in the past to do hazard vulnerability assessment, so I can look in a specific city or county level and pull up how many tornadoes they've had over the past, 50 years, or earthquakes. You can pull up all kind of data that way. Everyone will have access to that has a region account, so that Microsoft Office 365 account that I was just talking about, if you have one of those accounts, which all hospitals should have all those accounts, and again, some key members across the region, I think we have up to 32 accounts. If you have a swillhope.org email address, you will have access to this information as well to help build out your HVAs and the like. As far as regional projects, we have 4 projects, and I know, Eric, we talked about, I know you sent me an updated information on this, but we at least have this much in the budget now. But we have project requests from Fayette Health Department, Monroe Health Department, Anderson Hospital, and Boyd Hospital. They're doing projects within their organizations. And most of these folks have normally do something each year with the project. This is the least amount of project requests that we've had since doing the project requests process. I think the most we had was 11 at one time. And last year we had 7. This year we have 4. I know it's kind of a cumbersome process, but a lot of folks take advantage of that. And you don't have to do too much. But this year, we'll talk about it here a little bit later, we are asking that you potentially host a training or something if you're going to get grant dollars. We'll talk about that here in a minute. Occupancy and rents and utilities. We have found a space here in Fairview Heights, an open warehouse, to where we're going to now sublet. We're going to do a lease on a warehouse. We're looking at a 37-month lease currently, which is about $47,000 a year. Actually, it's actually around $53,000 a year. The first year, it's slightly less that when you enter it, and estimated utilities costs around $5,400. But this is going to give us a climate controlled, accessible warehouse that's not here directly at the hospital, that's in Fairview Heights, temperature controlled, electronic security, all of that, to where we can, because we struggle here at Memorial with some of the region space that we house stuff. And I know we house a few things out at some other hospitals that we may be able to pull into this new space. So that is a new item that we're adding to it. And then telecommunications, the FirstNet phones. All the hospitals and a couple of our providers, EMS providers, and our remote team have access to these FirstNet phones. So if you're new and don't know what that is, FirstNet basically is prioritized calling and data. You're probably familiar with the GETS and WEPS program. It's not that specifically, but it does give you access to higher priority calling via cellular, and it also is what we use for you see the Starcom radio fees and SatPhone fees that we have below there, but those Starcom radio fees, we have Wave access, and on those phones, we do have the Wave app, which allows you to get onto Starcom from your phone or from that phone specifically. So when you can see all those Starcom radio fees, that includes a lot of the radios across almost all the radios across the region, as well as Wave access. And then we do have a regional sat phone. We pay about $700 a year for, just in case all the phones are gone down. We at least have that type of access. And lastly is our training and education budget. This year, we've got a lot of stuff on the docket. This is from stuff that you guys have sent across the region to us. Some of this stuff is directly from in-house here, but it's going to be available to everyone. A few courses are remote specific, like I believe the austere emergency care course, and maybe that medical rescue systems course, but the CISM training, that's all for the region. We talked about enhancing mental health and dealing with tragedy and all that type of stuff. That's there. The de-escalation course, we talked about this. It's targeting EMS personnel. That de-escalation course, very expensive course, but we think it's well worth it to try to have our EMS folks and even some of our in-hospital folks take that so they can learn how to de-escalate from patients or family members, et cetera. So really good course there. The bloodborne pathogens course and the DICO course, that's an infection control course, the basic course. A lot of stuff that we learned out of COVID where we found shortfalls and people not being educated in the proper processes. These courses can help there. We're trying to expand our ability to put on more realistic exercises and stuff like that. So we have a Moulage training workshop and then an exercise that's kind of baked into that. We're going to try to hit that around the spring time frame of next year. So we have that built in. And then we got some oxygen generator training. That's for some specialists here, so they know how to use our oxygen generator in combination with the oxygen trailer that we have. So we can provide that when we have instances where we really, really need access to oxygen. And we had that a couple times this past year during the cold weather months. And this is finally going to kind of round out that capability that we'll have here. Few things that we have in our work plan here. These are the milestones and things. I'm sorry, they're not in direct chronological order by date, but these are things that have to get done this year. The coalition assessment tool, as soon as that opens up, that's normally in October, but has to be done by January 2023. We got to do at least 6 no notice EM resource drills. So I will again harp back on what Greg and I talked about with having access to EM resource. We got to update our plans. As we talked about over the last 2 months, that September is our target for that. So you'll need to be able to say what you want to have in there before that September 7th meeting, because that's when we'll approve those plans. Radio and equipment inventory, we got to do that twice a year. We got to conduct the Mercy exercise. That's another surge exercise. It took place of the Coalition Surge tool. It's slightly different variation. This past year, we got credit on the Amazon warehouse tornado incident. Then you got the integrated preparedness plan workshop and planning workshop. That kind of took place of the TEPW, the old training and exercise planning workshop. You guys are familiar with, just new acronym. That's it. Decon training, we got to offer at least 6. We'll probably offer more than that, but we got to do a minimum of 6, and we will do that. I think we lead the state in that area. Got to update our regional inventory suppliers listing or supply listing. We'll do that. You guys helped with that by allowing or letting us know what vendors that you guys choose from across the region and a few things that way. Execute that training plan that I just showed you, all this entire list of courses, plus the decon courses we're trying to knock out this year. And the Coalition Surge Estimator tool should not have any, I apologize there, but that's a very simple one. Again, it's a spreadsheet that all the hospitals have to fill out. Once they fill that out, we consolidate and compile that information and just provide you with an update to that. So any questions over the budget, what you saw here on the budget, and the basic milestones? There's more to the milestones or in the work plan, but that's the basics of it. So any questions with regard to that? Hearing none. Okay, we'll move on. Project proposals, again, as a reminder, they opened up 1 July. So if you go out there and you follow that link, so within the PDF that was sent out with these slides on it, you follow that link, it'll take you to that project request form for the 2023. I know I put, oh, excuse me, yeah, it should be 2023. I know I get in a time warp sometimes with FY24 and 23, but it'll be in FY23. These will be for the FY24 project. So I'll take this information and compile it and put it into the FY24 budget. So please fill out what projects that you think you need to you need for your organization. Hopefully they're better. They should be focused on bettering or making the coalition a little more prepared in one of the 4 capabilities. And make sure that once you've done those, you print those out, submit copies with supporting documentation, basically your quotes that you got off online or what have you. Please make sure you don't include tax within your requested amount, because you can't include taxes. It should be all tax exempt, and submit that to projectrequests@swillhope.org. So with that, for the FY23 budget, which is getting submitted today, does anyone object to any of the items that you saw proposed for what's going into the budget? Okay. The plan review. So we've talked about this last month. If to get access to those plans, these are all of our plans and annexes and our governing documents, our governance documents. You can follow that link. It'll take you to a spot where you can download copies of the plans and our comment review matrix. Again, as we talked about, you'll have until September 7th, because that's when we'll approve those plans. So that'll be the date of the new plans going forward. But this is your opportunity to provide any context, questions, concerns about those plans. Inside that folder from that link, it should take you to, or it should provide you what's called the comment review matrix. I'll try to give a quick demo of that here in a second on how you should fill that out. But basically, you spot something in a plan, you identify what line it is on that plan and what page number, and you put in the information you want to have changes put to. We don't want to receive a bunch of documents that have like track changes and stuff like that. So you'll just see PDFs with line numbers, and you can consolidate your information into that plan, and you can send those back to info@swillhope.org. You can send all of those, that comment review matrix, to info@swillhope.org, and then that way we can review those. All right. I got this here. Before I open the floor, I am going to transition and just share my screen quickly. This is the comment review matrix. So basically, if you're reviewing one of those documents, here, and I'll pull up one of the documents. I'll pull up our KIMPAC Annex. And you can see it says FY23 draft on it. And as you scroll down, let's say you're in this area and there's an error on this line. Maybe the word occur is spelled wrong. That's an administrative kind of change, but maybe that word is spelled wrong. What you would do is just go here and you would put in your organization. So I just put in my organization, put in my information. And I would say this is in the KIMPAC Annex on page 9. And then I would say here, again, this is page 9, line 221. You can see these line numbers here on the left. I would put line number 221. This is just an administrative change and misspelled word. Then I can go over here and say change occur to occur. And then we would take those information, we'd make the changes, and then the final document would be in a better position. All right, any questions on that, on how that process goes? And this will be for all the annexes that are in there. So you should see, I believe, a total of 6 documents altogether. Here. All right, let's take a look at those. That's Member Planet. This is the link that it should take you to. Member Planet document storage. All of these documents here. Should be able to download them and update them as you need. All right. Any questions? The floor is open. Okay, hearing none, then we will end the meeting here. I appreciate everyone's time. Giving you 10 minutes back of your life that you probably didn't think you were going to get back today. Don't spend it all in one spot. All right. We will talk at you next month. The next, here, let's pull this up just so you can see. The next meeting is somebody's going off there. Give me 1 second. All right, the upcoming events and next meeting will be August 3rd, our next meeting. Decon training on the 11th here at Memorial. Then coalition plans and document review. We would like to get all of your comments back by the 15th, so we can have them in there and go live on the 7th of September. So please get all of your comments back to us by the 15th of August. Again, if we don't hear from you, we believe that you concur with the document as written. So your silence is concurrence in that regard. And then we will approve them on the 7th of September. IAM conference is November 11th through the 17th down in Savannah, Georgia. And then the National Healthcare Preparedness Coalition Conference is November 29th through December 21st in Anaheim, so just outside LA. And then IDPH Summit, still to be determined if they're going to have one. Well, maybe we'll have one this year. We shall see. All right. That's all I got. I appreciate everyone's time, and I will, again, talk at you later. Gotcha, Danielle. Ciao.